We are back here on Carolina Women with our friend, Dr. Allison Flowers. Good to see you.
You too.
I love coming to the office. It's a beautiful morning. And we're going to be talking about something that oftentimes women like to talk about in private, but is oftentimes difficult to talk about.
Right.
And that is, I guess, is it pelvic floor? Is that really what we're talking about?
Yeah, so I think that, first of all, people don't understand exactly what the pelvic floor is, but honestly, it's really just a group of muscles, right? So a group of muscles, 3 different layers in our body that have such a vital role in our function. So, and support our organs, bowel and bladder function, sexual function, all these things that normally you don't have to think about until something goes wrong.
So pelvic floor is a group of muscles that is almost a foundation for us.
Exactly. It sits like a bowl and supports our uterus, our pelvis, our all of our organs, our bladder.
So now that you say that and you say muscle, muscles can be toned, muscles can be not toned.
Yeah, muscles can be weak, they can be really tight, and they can be uncoordinated. And so all of that can contribute to dysfunction like prolapse, leakage, pain, constipation, all kinds of things. Right?
So as we get older and we have children or we don't have children.
Right, either way. Yeah.
Exactly, either way, yeah. But I think of things like incontinence, I think of uterus prolapse. Can you talk us through some of those things and what treatments are out there and what you all actually do? Because as I'm thinking, I'm almost 70, I'm thinking, I would be curious. I would almost love to have an examination to see how toned, if there are things that I could be doing.
Yeah, I think that's a great question because oftentimes we'll even get referrals for, okay, this patient has prolapse or this patient has leakage with exertion or exercise or even just daily function, right? Strengthen the pelvic floor. Well, I don't always love that comment because I feel like, so that kind of gives you a misconception that, okay, let's just do some Kegels and we'll be fine. Well, oftentimes the pelvic floor muscles may not even be weak. They may be overly tight, right? And so if a muscle is overly tight, it can never fully be strengthened. So then you're kind of in this state of, you're walking around with this tense pelvic floor that can never fully let go or strengthen. And so we usually have to deal with the tightness first and then worry about the strength. Also, sometimes it's the surrounding body parts that are the problem for the pelvic. The pelvic floor has to work overtime for weakness in the hips or the core or the low back. So there's like so many contributing factors that go into treatment, more of a whole body approach versus just, okay, let's just do some Kegels and we'll be fine.
This is really interesting. It's sort of like I just had an epiphany. As much as we've talked before, sometimes you get to the point where I hear what you're saying. Right. So that again, I may be looking at a weak core that's contributing to something that's completely what I think is unrelated. And you're saying, no, they can be.
Right, and a lot of times we don't realize that through our daily life, we're actually, even taking a look at our breathing, right, how we breathe, are we just putting so much pressure down or bearing down through the pelvic floor versus actually being able to engage those muscles? So even just fixing posture and how we move throughout our day and how we breathe can have a huge impact on fixing problems like prolapse and leakage, or even when we're talking about postpartum, abdominal separation, right? Everyone thinks, oh, I'll just do some crunches and I'll be fine. Well, it's just so much more than that. It's kind of connecting to those deeper core muscles, getting everything to function the right way.
Is it really helpful for moms who have just had a new baby to come in and just get checked out and say, okay, what can I do? It's almost part of health and it is part of health and wellness.
Yes, that is my goal in life, is to make it a standard of care for every woman that has a baby to at least have one pelvic floor physical therapy visit after, just to check in, just to make sure everything's okay, and to get them on the right track to even prevent issues. So I would love our healthcare system to go a little bit more towards prevention, right? Versus, oh, let's just treat a problem once you have it. Like, why not prevent the problem?
Well, and so as we're talking here, I'm thinking really 2 main categories of folks. If you've had a baby, you're getting ready to have a baby, or you just have had a baby, number 1. As you get a little bit older, again, rather than find a problem and then come find you, maybe it makes sense to be seen just as a prophylactic, just prevention. It makes so much sense.
Yes, and I love that you said that because I actually have a few patients right now that have found us through TV or our website or so many different ways, and they're like, hey, I don't know if I have a problem, but can I come get examined? And I'm like, absolutely.
What's the worst thing that happens? I feel better. I love this. As always, it is so good to talk with you. I learn something every single time we are together.
I love talking to y'all.
Thank you for joining us here on Carolina Women. We'll be right back.